Good afternoon everybody, welcome to another Facebook live session for Restart a Heart Week here at South Central Ambulance Service. I'm Jack Ansell, paramedic and operations manager with the community engagement and training team, and we're here at Nursling Ambulance Station again today. Quite busy as usual, lots of comings and goings. All week we've been talking about how to restart a heart and the importance of people taking action when somebody collapses and has a cardiac arrest. Yesterday we had 999 Ted and Nick Dunbar, our head of operations, talking about how to do CPR and demonstrating CPR and defib with one of our amazing community first responders. Just wait for a few people to join us. Morning Vicky. This morning I'm very privileged actually to be joined by one of our community first responders who's come through the whole journey of having a cardiac arrest and is essentially here to talk to us today about his experience of cardiac arrest. So without further ado, I'm going to introduce David Jeffrey, who is one of our CFRs and about 4 years ago actually suffered a cardiac arrest. Morning, David.
Good morning, John. Good morning, everybody.
David, can you tell us a bit about your story, please?
So though I'm a CFR, I'm an IT professional by trade. It's my profession. About 4 years ago, one lunchtime I went for a swim. I was fit and healthy beforehand, swam up and down the swimming pool, got out of the swimming pool, sat on a lounger by the side of the swimming pool, and there I had a heart attack followed by cardiac arrest where my heart stopped for 7 minutes. Some of the people around me panicked, people who should have known better and known what to do, but one chap in particular was trained in CPR, he knew how to use a defibrillator, and that man saved my life. So he did CPR on me, one shot from a defibrillator, and then I was back in the room, and I've subsequently made a full recovery.
Well, that's amazing. Thanks for sharing that with us. So if someone hadn't started chest compressions and applied the defibrillator, what would the outcome have been?
The best way of describing it is I would be ashes in the urn on the mantelpiece as we speak.
But thankfully you're not. You're volunteering with us. How long did it take for you to recover? I'd imagine you had a few bruised ribs at the least.
There's two answers to that, short and long answer. Bruised ribs, cracked sternum, I was in pain. I can only describe it as being hit in the chest with a sledgehammer or by a truck, and that took a few months to wear off. For me, I was very lucky. I didn't suffer very much. I didn't suffer a brain injury. So the next few days after the arrest in hospital, I was fine. Came home from hospital after a week. It was probably about 2 months before I was back to normal. So I made a very fast recovery, and subsequent to that, I'm back to normal. That's
amazing. We've been talking a lot this week about people having cardiac arrests and doing CPR and using a defibrillator, and you are living proof, as it were, that it's not a magic trick or it's not mythical, it actually works.
It does work. I think people don't quite understand what they have to do in a cardiac arrest, and hopefully the work that's gone this week will help educate people. But the survivability of a cardiac arrest is very low, it's 7 or 8% better in the SCAS region. Of those who do survive, a lot of them have brain injuries because the heart stopped and there was no oxygen being pumped around the body and the blood. So they have brain injury and other organ injuries. So I was extremely lucky, even though my heart stopped for 7 minutes, that I got away with it without any injury. There could be more people like me if people were prepared to get stuck in when someone collapses in cardiac arrest and do CPR and use a defibrillator.
And what did your family make of the whole event?
Well, fortunately they didn't witness it. Very, very lucky in that respect. Though my wife had to get a train to London not knowing whether I was alive or dead, so they were slightly traumatised by it. My son, slightly more traumatised in that the whole event was captured on CCTV at the swimming pool, and me looking incredibly fat in a pair of swimming trunks, which fortunately weren't Speedos, but my son's actually watched the cardiac arrest, so I think it had more of an effect on him.
Yeah, and I'm lucky or unlucky enough to have seen that as well, and it's just amazing seeing you collapse on the camera and having a CPR done, and now you're sort of sat here talking to us. How's your life changed as a result of your experience?
Well, I don't sit on lounges by the side of swimming pools anymore. That's the first change in my life. It's changed me in two ways. One, I think psychologically, it's quite strange to articulate and explain to others, but literally the old David died on that day in July 2016, and there's almost like a new version of me, which sounds a bit of a contradiction, but I think I'm a different person. I'm more caring and more empathetic with others, and I see a slightly different direction and purpose for the rest of my life, having survived something as horrendous as cardiac arrest.
So you now volunteer as a community first responder with us, getting to patients quickly to give them the best possible chance of survival. Did your experience of cardiac arrest inspire you to do this?
It did. It sounds very cliched. After the whole incident, I was in hospital. I felt like I wanted to do something to give something back to whoever, to the community. Again, it's a very cliched thing. I work in IT, sitting on my backside in front of a computer, but didn't want to do something like that. So becoming a first responder, actually helping people in my local community when they need it, 999 emergencies, I feel is something I wanted to do, and I'm really pleased that I trained and have become a CFR.
And what would your message be to someone who witnesses a person collapse and isn't quite sure what to do?
I would say call the help, ring 999. The call handler will talk you through what to do. If you don't know how to do CPR, the call handler will tell you what to do. Get stuck in, start CPR. You call for help, maybe there's someone close by who go and get a defibrillator, but get stuck in and do something, because without you doing that, the person will be dead.
It is heartbreaking when I've been to jobs, and I will go to jobs, and somebody is in cardiac arrest, and there are lots of people stood around doing nothing because they're too frightened or they're not sure. So yeah, it is bad when people aren't doing something. So that's a great bit of advice. So if someone's thinking they ought to get round to learning CPR one day but they haven't yet, what would you say to them?
I would say you could do it. There is this view that heart attack and cardiac arrest are the same thing. They're not. This is only something that happens to old people. But the cardiac arrest can happen to anybody. It could happen to you, it could happen to your partner, it could happen to your child, it could happen to your mother and father. If you've learned CPR and know how to use a defibrillator, you can save their life. You can turn those low survival numbers into higher numbers. We'd like to have 15, 20, 25% of people surviving cardiac arrest. So if you don't know what to do, please learn how to do CPR. Please learn how to use a defibrillator. There are courses locally, Restart, Heart Restart courses, which you can contact to find out where they're doing a training session. Any questions you can always ask SCAS, and we can point you in the right direction. British Heart Foundation, I think, run courses. So I would urge everybody to learn CPR. It will only take half an hour to an hour of your time.
Brilliant. Thanks very much, David. So there we are, everyone. There is, if you needed any more proof that CPR and using a defibrillator works, you've just had it. So do what David said. Have a look online. Find somewhere that can teach you how to use defib and CPR. Watch our videos on the SCAS website and the SCAS YouTube channels, because you don't even need any formal training. Just watch the videos and learn how to do it. Thanks very much for joining us today. We're back tomorrow for a Restart a Heart quiz, I think. So watch back on our videos to make sure you're up to speed with anything we might be asking you. Thanks very much for joining us, and stay safe. Speak to you soon.